Welcome to the Nano podcast. I'm your host, Will Chernlin, and I'm excited to have you join me on this journey through the world of nano-cap companies. For the past decade, I've talked to thousands of business owners across various industries. It's been an enlightening experience revealing the vast tapestries of entrepreneurship and innovation that thrives beneath the surface of mainstream media coverage. Each week, I will interview different leaders of nano-cap publicly traded companies to learn about their history, what they do now, and their future. As a reminder, none of this information is financial advice, and it is all for entertainment purposes only. Let's start this week's episode. Hi, everyone. In this week's episode, I have the pleasure of speaking with Kathy Lee-Sepsik. She is the CEO of Femasys, stock ticker FEMY. Femasys is a women-founded and led biotech company that helps to meet women's needs worldwide by developing a suite of product candidates that include minimal invasive to non-invasive-ish in-office technologies for reproductive health. Kathy, thanks for coming on the podcast.
Thank you for having me.
So first and foremost, I was looking through your LinkedIn and such, and you kind of have an interesting way where you have a biotech background and kind of a little bit of a business background. How did you get into working at Femasys? How did you become where did the idea come from? Can you tell me just a little bit more about your background?
Sure. I have been in medtech for a number of years prior to founding Femasys. The focus I had was more in cardiovascular and orthopedics, looking at devices as well as biomaterials, and both of those lent itself very well to progressing technology here at Femasys. I founded the company specifically in women's health because I felt personally there was a dearth of innovation, a lack of suitable options for really what I consider basic healthcare needs. And I thought with my background, I could actually make a difference for myself as well as others like my daughters and other women that would come behind me from an age standpoint. But that was really the premise of it. It was kind of a personal decision, and looking at women's health and being able to leave the kind of impact that I think we will leave behind was very alluring.
And so I read somewhere that you have over 100 patents. Did
over
the patents kind of
now?
Wow. So were you stacking up your patents throughout kind of your career, or these all come once Femasys was founded?
Yeah, I was never really named on any of the patents prior, but had a very inventive nature. And I took kind of my know-how in these other areas and said, why haven't we brought women's health into this century? And took that know-how and secured IP around it. I then just continued to invent. Everything is at Femasys, nothing is in license. Everything is pretty much has been generated primarily through me, and of course through my team to augment kind of the IP around these initiatives. But it is quite a big IP portfolio. There's several products that we have under development and that have also crossed over from a regulatory approval standpoint. And we'll continue to broaden that IP portfolio because unfortunately there's lots of areas within women's health that require an upgrade, so to speak.
And so, okay, I gotta ask. So are you switching between like a blazer and a lab coat throughout the day, or do you have some days where you spend more time researching and inventing and other days where you got to deal with like administrative and accounting stuff, or how do you split up your time?
Yeah, in the early years, it was heavy development. To be honest, I either was raising money or developing the products. And now that I've gotten them to the stage that they're at, many of them, I'm able to step out and let the R&D team and my manufacturing team. At Femasys, we do all of our own manufacturing as well as full R&D. So full facility here in Georgia, which is also unusual for a company of our size. But so the team has now taken the ball and they are refining and looking at next generation, and then obviously transferring it into manufacturing and looking at how do we continue to produce these products at the highest quality and at the lowest cost. So my inventive days continue, just not quite at the pace I was going in the earlier years. And some of these products are less regulated, others highly regulated, so they're all, through the regulatory process. So I'm able to pull things through, some of them quicker, some of them a lot slower. So I spend more of my day in the jacket, in the suit, and talking to folks like you and spreading the word and building awareness, because the company is commercializing for the first time in 20 years with a commercial team. So this is lent itself to being out in the community in a different way than the early years.
Very, very interesting. And two, the idea that I bet everyone in your field would just love to actually own all their own patents and have their manufacturing in-house. And you all are set up kind of uniquely to have it all vertically integrated in one place. And so that it's one of those things you have to plant all those seeds, I assume, but just sooner than later, it's going to turn into this giant forest as you kind of build up this IP and make sure that you don't have to deal with any middlemen.
Yeah, and further to that, there's just in the areas that we're working in, which I know we're going to dive into deeper, there's literally no competition. In most of the sectors that we're working in, we're replacing 100-plus-year-old technology. So that's the other thing we decided to do. I didn't want to just have a marginal improvement to what's out there. I wanted to have an opportunity to change the standard of care. And when you do that, you're looking at lots of broad IP and protection, because people aren't working and aren't improving in those particular areas. And they're pretty big areas of need. So it's really shocking. But as a company, we're also in a unique position where we don't have a lot of competitive threat, unless you consider something that was developed in the 1800s.
Well, that's going to kind of lead into my next question of just in your own words, what does Femasys do? What makes you all special? And what's kind of your suite of products?
So I think what makes us highly special is that we focus in the deep areas of need. We are making revolutionary products in which the market has never seen before. We are very adept and have strong expertise in the areas that we're working in. And as you mentioned before, these aren't things that you can just do overnight. We have full-blown manufacturing here. We've been doing it over a decade. Excuse me. And we've had our systems audited. We have high quality products that have been confirmed through various different auditing bodies, including FDA. And we're properly ready to introduce our products into the market with clinical data. And so we've had to run very large clinical trials. So this is well prepared, I guess is the best way to put it. We didn't want to just have something, get it sold, and then flip out. This is meant to be something that's here for a long time, and that we're able to bring a number of products through this infrastructure. As far as the suite of products that we've developed, I looked at the two ends of the spectrum for reproductive health. I have an infertility line of products. It's a crisis in this country. We don't have a birth replacement rate to speak of. So we wanted to create something that's more cost effective, that's safe, that women can have access to, because very few women end up at the most expensive end of care, which is all that we hear about, which is, for instance, IVF. It has a place in this world, but only about 200,000 IVFs are being done every year, and there's 10 million infertile women. So we want to change that. We want to be able to engage patients in that beginning part of their journey. So we have a diagnostic product that also moves an essential test to look at her fallopian tubes, which is where conception occurs. And we do that with ultrasound as opposed to sending her to radiology for a referral. That's a really great example of a revolutionary product. We're the first of its kind. And we have taken a point of care from expensive, risky radiation exposure to ultrasound, which is something that every GYN office has readily accessible to them. Femasys is our infertility therapeutic product. We place sperm directly in the tube where conception occurs, and we do it in a safe and efficacious manner. And it's done, in our view, would be the beginning part of a woman's journey. Everyone knows that IUIs, which is the oldest form of reproductive care and assistance, it's many decades old with no improvements, and we can do better than that for women and couples alike. So that product just received approval from FDA the end of 2023 and enabled us to engage in a commercial presence for the first time. The other product on the other end of the spectrum, which is ever so important for women that decide they no longer want to be at risk for pregnancy, we have a non-surgical permanent birth control in development called FemBlock. This is a product that a woman would walk into her GYN's office. She would after a few minutes, receive our technology, and she would walk out the door and resume normal activity. And we're giving an option to surgery. So this product is highly regulated. We're in our 4th clinical trial, working, closely with FDA. There's a dire need for a product like this, particularly in our environment with a Roe v. Wade decision, a Dobbs decision, where, women have less access to other care that they may need. So we're looking at trying to find a way to have women not find themselves in a situation where they have to consider an abortion because they got proper birth control, one that doesn't have hormones, doesn't have implants, and can be safely performed. So those are a couple of the products that Femasys is working on.
So quick side note, with all the other biotech, biomedical companies I've talked to, all the names of their product are so bad. And all of your products actually make sense, and they actually go along. So I just kudos to that branding of actually not having to sell
I named the products too. Thank you.
Okay. Yeah, you're not selling a azithromycin or something crazy. It's got something very standard. So with the birth control, you're saying no hormones. So does it just physically block sperm from entering the fallopian tube, or how does it do that?
So we have a delivery mechanism that we've developed as well as a biopolymer, and that lends itself to my background in biochemistry. We wanted to develop something that was temporary, that would degrade, and it basically elicits a wound healing response and leaves the patient with her own tissue. So it's the safest way you can approach a problem, a need, by not leaving her with something foreign in her body that could, one, not last as long as we all hope, or two, cause safety concerns. So we wanted to eliminate that need for an implant and also eliminate hormones, because as women age, we have a higher likelihood of developing blood clots, a higher risk of breast cancer if we stay on the hormones. But there's no other option but going to surgery, which has its inherent risks of anesthesia and incisions and longer recovery time, and it's expensive post a pandemic, to even get OR time. So there's a dire need for a product like FemBlock, and it obviously has global implications. And we're excited to continue to move this product forward, and we hope to accelerate those efforts and get it on the market before long.
And you had mentioned you've been doing and solving these kind of problems for 10 years plus. Have you felt a big vibe shift in the last 3 years where people are actually talking in the general public about infertility and it's not as taboo anymore? And people are talking about, no one knew about the population replacement rate 5 years ago, I feel like. And no one was, even just lately, IVF. And like you said, the Dobbs decision. Do you feel like, in a macabre way, that you've become the belle of the ball in the last few years, where you're finally everyone's understands that women's health is something important? People are finally listening to me.
So it's been 20 years, Will.
20. Oh, wow.
Yes,
okay.
Yes, 20 years of pushing this boulder up a hill. So I do think this is our moment in time. It takes a lot of effort to do what we've done and to get it to this stage. And it's just, I hate to use the coined term of perfect storm, but it really is. We have a political climate where we're looking at women's rights, where it's a top of mind discussion, where clearly our country has an infertility problem, but we're not alone. We'll see this happen in Japan, even in China with a third child policy, in Europe. So all of the countries around us are also experiencing these similar needs. So top of mind discussion, and people do want to have a family. So how do we make it more affordable? How do we give them a better chance? And how do we do it now? So this is a really important moment in time for Femasys. We've been through a lot as a company to continue to still be here. It is an underfunded area. There hasn't been a lot of bells of the ball, to use your terminology. So we're hoping to be that one that sticks out and survives it. We have a lot of products. So I think that differentiates us too. We didn't go all in on, let's say, FemBlock, which easily others have done. It's a multi-billion dollar market opportunity, but we took our know-how and we developed products leveraging that skill set for other areas of need like infertility. And that's something we can bring here and now while we train on our delivery mechanism for the future when FemBlock comes, equally as important for women. So I'm hoping People will watch your podcast. People will look at the stock. We're incredibly, beat up as well as other companies in our space. So we're excited about the conversation around women's health and the needs.
So you've mentioned a couple times just like what a like worldwide and global company Femasys is because of all the problems are everywhere around the world. As for like the regulatory approvals, is there some of these like smaller countries who almost like outsource their regulatory approval to the FDA, where if you get FDA approval, you have that much easier chance to get in there? Or do you have to start from scratch once you get into Japan? Or like, how does it work country by country? And is there some places where you go, okay, Netherlands, we know we can get in, but Germany, it's going to be years? Or how does that all work?
Yeah, so the European approval process has changed over the years. It's now called MDR, and it's very grueling for companies. We started that process years ago, and we have just come through with the CE mark on all of our products, including Femasys, our therapeutic for infertility. That is a amazing undertaking, if I can pat ourselves on the back here. We cleared the MDR certification process without even an observation. And that bodes to our manufacturing processes and systems and our quality control that we have here at Femasys. That is a very difficult undertaking, and many larger companies that have to bring through their hundreds of products are abandoning Europe right now. So we have achieved this, both the MDR certification and CE mark just recently, just a couple months ago. And this is really also further helping us stand out because we are putting our money where our mouth is. We're doing the work, and we're getting the approvals. We're also approved in Canada. We got the license, which is called MDEL, so we can service Canada directly because it's a market that's difficult from a cost structure. So we really don't have the money to have a distributor and then go to the end user. So we bypassed it and made sure we had the appropriate approvals in place. From the standpoint of countries like Japan, the MDR process does cover Japan. We do have a product, FEMY, for that, looking at the fallopian tubes, which needs to be open for conception to occur. We've been selling through a partner in Japan already, so we've proven our ability to get approvals in Japan, to manage the audits that come alongside of a large partner. It's Bayer in Japan. And so we have been able to do that for about a decade. So as we now focus not only in the U.S., we'll be looking at specific countries with the largest, greatest need and continue from there because we do have the approvals in hand now.
So as we talk about market demand, is there certain demographics in, say, we'll use Japan as an example again, where Japan is not looking for the fem blocker as much, where other countries may be looking for the fem blocker as much? Or like, does each product have kind of just the same demand in each demographics? Or how does that work kind of country by country?
So I'd say globally, broad scale, everyone has a demand for an infertility solution, whether it be lower cost diagnostic as well as a therapeutic that's lower cost and safe. There are not enough infertility specialists anywhere in the world. So there's high demand, not enough physicians. Our products can be done by what's called advanced practice providers like nurses, MAs, PAs, that were actually included in our trial for Femasys. So we've been able to show that that level of expertise can perform our procedures because they are augmenting lots of procedures around the world and in our country specifically. As far as our focus as a company, we're doing a lot for the size that we are. So we want to make sure that we address our home country here in the U.S. And then we'll pick up other countries as we continue to get funded properly, as we're able to strengthen our commercial team and be able to bring our products into these other countries. We're already securing the approvals. We're staying well ahead of the game there. It's just really more of a limitation of resources and a need for additional funding to be able to support those efforts. Unfortunately, that's just a fact, and that's how we have to stay focused to make sure that we're here for the next run of it. From a patient standpoint, when a patient is trouble having a baby and we're able to help there, she becomes fertile and she too still becomes a potential FemBlock patient because she may only want 1, 2, or 3 children and then not want to continue or have an oopsie baby in her 40s or 50s, before menopause. So we see a broad need for FemBlock. We're also seeing it in women that are choosing not to have children at all. And we included that category of woman in our clinical trials, which are ongoing right now, because we wanted to make sure we covered everyone. Not our choice to be made, that we included them in the trial so that we could speak to the efficacy around it. So we're here for all women, depending on where they are in their journeys, but it could very well be the same person that's infertile that still needs something for contraception down the line.
Yeah. So in your perfect world, not guess perfect because they're having some sort of issues that they have to come to you, but would a woman potentially in her lifetime like interact with like 4 different Femasys products
You know, it's
as they kind of
possible.
work through?
Yeah. Yeah, it's very possible because we do actually have other lines of products. What we're seeing that, you had asked earlier in the last 3 years, some of the shifts that we've seen in the market, there is now an awareness of the component related to sperm and low sperm counts that are coming into play. We've had such a focus on the female infertility factors and things to address for her, but there's a notable unexplained infertility patient population. Some would say it's the largest segment for women, and it's the male factor that's coming into play. Roughly 50% of the time, the male factor is an influencing factor, and it's low sperm count, and that's been defined around the world. So for the way the Femasys is designed, it's designed specifically for that low sperm count because we're placing the sperm directly where it needs to go. And when you have less of it, it makes it even more important that it doesn't have to just lose itself in the hostile environment of the uterine cavity. It actually makes it into the tube. So we're aligned to that greater need. And so, yes, the woman has to go through the procedure, but in fact, 30% of the time, it's only a male problem. It's hand in hand for both men and women and for couples at large. And we're seeing a demand for the LGBTQ community as well as single women that are on the rise that want to have children as well. And this product is an insemination product, so they don't actually have to be infertile to want to undergo the procedure.
Awesome. So kind of as we wrap up, how does Femasys stay ahead of the competition? Is it the vertical integration? Is it having multiple products? Or what do you really see as your special sauce that's going to kind of project you guys forward into the future?
I mean, I think what we've done is aligning our products into areas and segments within each area that has no competition. We're kind of alone. So from a non-surgical permanent birth control standpoint, there are surgical tools for tubal ligation, but there's no real competitor. So we are literally standing alone to address a multi-billion-dollar market opportunity with that particular product. When we look at Femasys, we are not here to replace IVF. We are here as a continuum product. We are here to address the millions of women that will never end up at IVF. And we're here to enrich their process. There is nothing like it. We are not an IUI. So it's, a segment that's kind of there on its own. We need to build awareness because these things are new. And then, we are protected from our IP position, but it then lends itself to our other products for these patients. So I don't actually see the normal competitive threat unless you're talking surgery or you're talking expensive IVF, but we're here to offer the beginning stage, the less invasive option for women to address these major needs.
Usually I wrap up these podcasts kind of asking like what excites you about the company and what gets you out of bed in the morning. But I feel like it's almost redundant at this point. I can feel it. I know I feel it through your voice, your enthusiasm that no, it's very clear why you're doing what you're doing and how you're trying to help people. So I'll just skip over that question, but kudos to you. So as we kind of really wrap up, where do you see yourself in the next 5 to 10 years? 10 years from now, what would be the perfect situation? Are you approved in a dozen countries? Have you found 5 more product solutions? Or you're just doing what you're doing now, but just getting 1% better each day?
I mean, 10 years from now, take me to 67, by the way. There's so much to get done in women's health. I actually see our products gaining traction and being household names and replacing standard of care and offering these options for women and affecting so many lives. But I also see an opportunity for us to be a repository for other great ideas that are out there that will literally not make it on their own. There are 40,000 GYNs in our country alone. You have to have a large sales force. You're going to have to finance aggressively to be able to get there, and small initiatives that, albeit may be important, they're not going to make it on their own. And so perhaps Femasys will move from self-inventing and self-researching and developing products to being able to take other products on and even broaden out our women's health portfolio even further and be a major household name player in women's health, because lots of large companies have abandoned women's health. J&J is a good example of it. They do not have a women's health, focus point, and that's a crying shame. So there's a huge need for another player, and one that takes the kind of care that Femasys takes in all of our products. So 10 years, I think we'll get it done.
Yeah, we're going to have someone at McKinsey head over to J&J and explain to them with some graphs that women are 50% of the population. They're missing out on
them. They're not the only ones that don't have a women's health initiative. So they're just one of many. It's a very small space as far as large players. And, there's reasons for it. But I think having a company that's successful will drive more innovation, and it might drive more investment dollars to others. And it's a big wish for me to see that the whole area transforms on the back of some successes. And hopefully Femasys is one of them.
So thank you so much for joining us. For our listeners who want to learn more about what you're up to in your work, where can they find out more information about Femasys?
Please come to our website. It's www.femasys.com. Follow us on social media. We have Facebook, Twitter, Instagram, and keep an eye out for us. FEMY's the trader trade stock symbol. We trade on the NASDAQ. So certainly we put out information regularly.
Awesome. Thank you so much, Kathy. And for those still listening, please remember to subscribe and review. Thanks.
Thank you, Will.
This podcast is for informational purposes only and does not provide financial, legal, or any other advice. The information is not investment advice or any offer to buy or sell any securities or to make any investment. The views expressed by the guests are their own, and any reference to third-party products, services, or information does not constitute an endorsement, therefore, by NanoCap Podcast or its affiliates. The NanoCap Podcast